good question here. So we got one in the chat, IMG specific question. Since I can't start electives without my step 1 score, are observerships seen as valuable experience for an MS3? So depending on where you, and I'll show my screen again here and then take some notes while we're talking. So ships for MS3 as an IMG. There is like a massive dichotomy of preferences here. And so some people will tell you that they're really useful, and some people will tell you that they mean essentially nothing because you're not actually actively participating. So I would say I don't want to say my official stance on it, but pretty much how I feel about it is, number one, if it's in the field that you're interested in, like if say you know that you want to do GI and you do an observership in GI, obviously that's going to be beneficial because you're going to be able to gain real tangible skills that you will carry on for you maybe throughout the rest of your career. You'll learn stuff, you'll learn pathology, you'll see stuff on a daily basis, procedures, get your hands wet, that type of thing. And that's awesome. Is it going to make or break your application? Probably not, honestly. Like when I'm going through applications, whether somebody's an IMG from, let's say, Libya, or somebody is an IMG from the Caribbean, whatever it is, I don't really honestly go through there and see what months they spent where. Like that, I'm just being totally honest with you guys. And every person that reads your application is going to be a little bit different, but I don't know anybody in my whole program actually that does that. It's just really not that mission critical to us. Like what matters more, obviously, is your scores, your letters of rec. Obviously, your personal statement has to be solid. Personal statement's one of those things where it's better to just be like kind of normal on it rather than like trying to be insane or like too little, too much type of discussion. But really your letters, your most impactful experiences, since you only get 10 now on your ERAS, breaking down the ones that were the most impactful. Obviously, we all want to see what shaped you into who you are. And then obviously the scores are just like part of the screening criteria. At the end of the day, even for my program for vascular surgery, like we interview people with like a 40-point breadth of scores, essentially. Like we'll have people scoring like, actually, I've seen even a higher than 40-point breadth. Like I've seen people with like near 280s interview at our program, and we've interviewed people with literally 50-point scores less than that. And so once you get the interview, it's really more how you perform on the interview. You just have to basically get your foot in the door. And so how you do that is a lot of programs will have tight score requirements that are cutoffs, which is fine. You just meet that cutoff. And then if you're above it, then you're in shooting range. But also, like if you have a letter of rec from somebody that knows somebody at the program, a lot of people get interviews that are below our score threshold simply because they rotated or they have a letter of rec from somebody that was like an old attending at my hospital or somebody that knows the program director, for example. So that's why you can never go into rotations and kind of have like a passive approach, not try and make connections, not really introduce yourself to people, because you never know who you might know. Like just for example, this is one crazy example I learned about today. Our newest transplant attending, she was a resident when one of our trauma faculty was a trauma fellow at her hospital in Texas. And so she actually I don't know if she got the interview because she knew him, but she actually like made that connection, and that gave them more conviction that she'd want to stay for a job here because she had that connection and friendship with some of the trauma faculty. And so you never know whether it's a job now, a job in the future, a residency, a rotation. You never know what just one connection can get you. Like, for example, one of my prior actual potential mentees is literally a resident at my hospital. Like, and I'm just going to leave it at that. Like, you just never know. I had a mentee that stayed at my house for the last 30 days named Kyle. He's applying psych this cycle. He did a rotation at my hospital. And obviously, I'm sure he's going to rank it highly. He enjoyed the time. He enjoyed being in Little Rock, and it was a pleasure. So you just never know where one connection will get you. And I'm not even saying if it's me. It could be literally anybody you guys meet in the hospital. Anybody from like the nurse at the front desk to somebody that you meet in the OR to faculty, whoever it is. But really, at the end of the day, depends what you get out of it, your observership. So if you're somebody that's going to be passive, your observership is literally not useful. If you're somebody that's going to make connections, it could be awesome. Right. And I just wrote in here, it really depends if you're a passive or active learner, and that I personally don't look at what observership student applicants have on their ERAS when I review. But if you really make something out of that opportunity, then you really never know where that could lead. Great questions, guys. This is what I like doing these live sessions for, is to just fire away any types of questions you guys have, stuff like this that you can't really get a good straight answer online or from friends, or they just don't know. I'm more than happy to answer anything.
I have a similar one if no one's got anything.
Man, fire away.
So this could be helpful for anyone like me who's choosing rotations and electives and scheduling them for fourth year.
Yeah.
I'm off cycle, right? So I'm starting now, January. But what would you advise for someone who maybe thinks the field they want, but is not sure yet? And what's the importance of, do those need to be the programs that you're going to interview at, or can you bounce around? You only have a limited amount of them. So what's the strategy on scheduling electives? Is it better to do one attending like a one-person outpatient practice, or like a big program that you probably want to apply to?
All right. That's a really solid question. I'm just writing down all the different questions that you had here. Should they be only at programs you want to apply to? Should they at small outpatient setting? What if you're stuck between two specialties? Okay, so should they only be at programs you want to apply to? Well, this certainly will help. And so the thing that I want people to think about when you're scheduling your elective rotations is think in the back of your head, what letters of recommendation do I have and which ones do I need? Because if you're applying for a specialty and have 0 letters of recommendation in that specialty, that's going to look really weird to your interviewers. It's going to look like you're not dedicated to that specialty. So you certainly want to apply to programs that you want to actually get to know a little bit about in terms of maybe matching there, but also in the specialty that you're applying to so that you can get that letter of rec. If you're wanting to do a subspecialty like a fellowship in internal medicine or a fellowship in anesthesia, pain, or a fellowship in general surgery or whatever it is, then you can actually have letters from those individual fellowships and they will apply for that specialty. Like, for example, I applied to vascular surgery, obviously. I had a general surgery letter, a cardiothoracic letter, plastics letter, and a vascular letter. And so all my other surgery letters actually still counted in my application process. But if I didn't apply with a vascular letter, no vascular program would take me seriously. So definitely you want to at least get one letter in the specialty that you're applying to, and then you can have letters within the subspecialties or fellowship options. If you're applying for a primary care specialty like IM or FM, it's generally okay to have letters of rec from programs that are pretty similar. So like, let's say you're applying to internal medicine, you can have a family medicine letter. It's not going to be the end of the world. And it still shows that you're a good clinician and primary care provider. But definitely, I would recommend doing it at a program that you want to apply to, because it certainly will give you connections that you can make. So you can make connections, get letter of rec from faculty at this program. And obviously, when you're interviewing there, they're going to see, oh, like Dr. John gave this applicant a letter of rec. I mean, he's our chair of this cardiothoracic division. So that guy must have really impressed somebody at our program. And that letter is going to count for even a little bit more than a strong letter from anybody. So that will really help you stand out. And obviously, they're going to go up and ask the person that wrote your letter, like, hey, how was Jesse? Was he cool? Did he work hard? Was he motivated? Was he somebody that we could see fitting in with our culture? Because really the biggest question is, the biggest question for the programs is, does this person fit into our culture? Because they want to have a team that works cohesively and they're all kind of in alignment. Like, for example, in our interview process this year for vascular, there is one girl that some of our program really, really liked, and every one of the residents did not rank her. Like, we literally wanted to DNR her. And the reason being is because she was so against the vibe of our program. Like, we're all pretty laid back, like we're all chill. And she was like the exact opposite. We just knew that we would not vibe with her. And so the residents were like, hey, listen, we do not want to rank this person really highly, even though the attendings wanted to rank her high because of her CV and her criteria and whatnot. So it's kind of a fine balance, because at my program, for example, the residents have just as much say, if not more say, than some of the attendings, essentially, if you all kind of like bond together on a discussion on an applicant. And obviously the program director at the end of the day has the final say, but if all the residents feel really strongly about a person, then that says a heck of a lot. It definitely weighs heavily in the mind of the program director when he makes the final say. So really, they're just looking for somebody that fits into the culture. So you rotating there, you get an idea of their culture, and they also get an idea of who you are. So that's huge. Your next question, should it be at a small outpatient setting? I actually recommend to do at least one rotation in a small outpatient setting. So this could be like a private practice. And so the reason why this is awesome is because it will most likely be just like you and the attending, and you guys can bond and you can learn a crap load because there's no residents. There's really like going to be fast paced, you and the attending 101. He's going to obviously, or she's going to write you a super strong letter of recommendation because you guys vibe for the whole month together. But also it's like, it's an experience that you're not going to get whenever there's like 5 or 6 residents that are ahead of you trying to learn something. So there'll be less gut work. There'll be like really more kind of getting your feet wet type stuff. So benefits is super strong letter of rec. I actually did 3 months with a plastic surgery attending that I ended up becoming really good friends with. And he obviously wrote me a letter of rec, and I'm sure it was probably strongest or one of my strongest letters of rec because I spent so much time one-on-one in his plastic surgery clinic. So you get a super strong letter of rec, make strong connection with attending, and they can also vouch for you and leverage some of their connections. Also, you're going to do less gut work than you would in the hospital. So it's not like you're just running around like pulling people's JP drains and like doing incentive spirometer with them. You're going to actually like be doing surgeries all day or whatever the subspecialty is. So those are kind of some of the benefits here.
What a random question. Like, what if you did a subspecialty that you're not going to apply to? Would that be any use, or just like say plastic surgery or dermatology?
It can be. You can still get a letter of rec, but just ask them to focus more on your character rather than like that you'd make a good dermatologist, for example. But I would only have about 1 character letter out of your 4 that you can upload. You have to have 3 minimum, 4 maximum. And I would only have 1 of them that's like just kind of tangentially related or not related at all. And they can talk about your work ethic, that kind of stuff, but make it very clear that if they write you a letter of rec, you want it to not be because you're applying to that specialty, obviously. It can certainly still be useful.
Yeah.
And a lot of people actually do that later on in the cycle after they've already got their letters of rec or after they've already sent in their applications and stuff. And they're like, dude, my cousin is a dermatologist. I just want to chill. Can I rotate with him? Whatever. I don't know what the rules are at your specific program for that about getting rotations approved and stuff. But I've had a lot of students do stuff like that. I had one girl that actually like rotated with a family member, and I don't know how much she actually did on a daily basis, but it's something that you can certainly keep in mind. And then to your other question, what if you're stuck between 2 specialties? So I would recommend to do the specialty with harder requirements first. And so, for example, like if you're stuck between, let's just pick 2 specialties here, like family medicine and general surgery. Obviously, the requirements to match into general surgery are going to be a little bit harder, and it's going to be harder to get a letter of recommendation just due to the nature of general surgery. So you're going to want to do those rotations first, and then you're going to want to do the family medicine rotations later. And so let's say your rotations start around August for your M4 year. So you could do like August, September, you would do general surgery rotation. And then October, November, you would do like your family medicine rotations. And you can dual apply, obviously. It gets tough if you don't have enough letters of rec to apply for both specialties. So definitely if you're in between 2, during your 3rd year of med school, you want to try and get at least enough letters of rec to apply. And so most people are not going to be able to do this simply because they're just not going to be outspoken enough to try to get all these letters. But you want to for sure have a gen surg letter, for sure have a family medicine letter, and it's pretty useful to get like an internal medicine letter after that because you're going to rotate on all 3 of those specialties as an M3. The family medicine letter and the gen surg letter obviously apply to that specialty. The internal medicine letter can be applied to both. It's going to talk about you clinically. And then depending on how heavily that you're leaning towards gen surg versus family, usually the ERAS applications are going to open up in November. So you want to have your letters September. So you're going to want to have your letters by the end of September for the application to open. So you have to kind of weigh all that in your mind. But generally the sweet spot is, and some schools will actually start you in June or July too. So let's say June, July, then August and September. You want to front load the gen surg rotations and backload the FM rotations. And if you're going to keep doing rotations into the interview season, like October, November, December, like you want to also have your easier rotations then because you're not going to be able to take off as many days on a more busy rotation generally. So if I was breaking this down, actually, this is what I would do. I try and get like the June, July for like your gen surg, and then August, September for your family medicine. And then if you're going to just kind of make the rest of your interview season easier rotations, you can do that after that in October, November, December timeframe. But so if you're stuck between two specialties, you can do that, or you can just pick a specialty and go for it. Obviously, that's not ideal. I do have a video on YouTube that's kind of useful, I would say. And it's kind of the 7 ways to break down which specialty that you should go for. I definitely recommend to watch that if you haven't. But at the end of the day, a lot of people are looking for a specialty that's going to fulfill them, that's going to make them feel like this is kind of the best thing since sliced bread. And it's not always going to be like that. One thing I found is that you end up liking what you get good at, regardless of what you get good at. And so, like, a lot of people get super turned off from, for example, some of the more intense rotations like OBGYN, because it's super intense and it's hard. But if you like that, and if you can get to a certain knowledge level and skill level where you really enjoy that rotation, like, I'm sure it's a lot more enjoyable. And same with Gen Surge. Like, most people don't like it because the hours suck. It's really stressful because you're getting yelled at type thing. But once you figure it out and once you kind of get into flow state with it, then it can be fun. It can be cool. I actually disliked vascular a little bit my intern year of residency because it was just so much information and so overwhelming that I was like, man, this stuff is tough. Like, it kind of sucks. But the further I get into it, I'm like, okay, cool. Like, this makes a lot of sense. I know why to do this. I'm kind of creating all the surgical plans in my head before that we do them, that type of thing. It makes it a lot more enjoyable, obviously, than when you're an intern just getting yelled at the whole time. So that's all kind of things to think about. Does that answer your question, man?
Yeah, makes sense. Yeah, that's helpful.
Awesome. Any other questions here? We're going to call it a night. If not, we're running up here on an hour and my cat's like literally about to break down the door, trying to get back outside. We'll have a guest appearance here. But awesome, guys. I appreciate y'all for hopping in today and asking some really, really awesome questions.